Apparently I'm here twice. Well, you know you need to lose some weight.
Now you're not.
There you, oh, that was you, Miss Denise. I got 1 minute till. We'll give everybody till 1 minute after and we'll get going. Hey, Miss Virginia.
Hey, Pat.
Hey, Mr. Louis.
Hold on, I'm sending it.
We'll give everybody 1 more minute and we'll get started. Hey, Miss Jamie Lee. And crew, if you will, if you haven't already, guys, put your name and organization in the chat box, please. We use that for attendance purposes. Thanks.
I need a camera.
Jamie Lee, I'm muting you because I can hear you. Hey, Miss Pam. Hey, Mr. Reed.
Hello.
What's that?
All right, I've got 3:01. We're going to go ahead and get started. Welcome, everybody. It's February. We've already gotten through the first, we're 1/12 of the way through the year already. And I don't know about anybody, but it's been a whole lot of Mondays so far this year. The rest of the year is like this. I'm not sure. I want to do it, but I'm going to go ahead and let me share my screen here. Got a couple things to cover today, but the most important one just right now is we're going to talk about, if my screen will move. Somebody just acknowledge that you're seeing the screen.
Yes, ma'am.
We're going to talk about our point in time count. Point in time count is this year has been moved, as all of us are hopefully aware by this point, from the end of January to the end of February because of our post-holiday COVID surge. And we're going to go through a quick training session with everybody here. Again, we're going to go through, and this is going to be a quick, we're not going to sit here and go too in depth unless you guys cry out and want to. But this way we could get everybody here a quick training session, so you could sign up to volunteer and go ahead and download the app and start doing your practice training or your practice assessments, so that it would come to a point in time count that you'll be ready to go. So the first thing is, I'm sorry, I clicking that, is to locate the Counting Us app either at the Google Play Store or on your Apple Store, and to go ahead and download it. Download the app, and then we'll begin the registration, which is simply creating a registration for yourself. Some of you have done this in the past. It's moving without me. May remember your passwords and your registration from last year, and if you do, that's great. If not, just go ahead and re-register. Remembering that your login is what we'll use during the count, so you'll need to remember that and use a password that you'll remember, and it'll take you through some simple questions, do your password, confirming your password, and then your account would be successfully set up. Any questions, concerns? I know Denise is monitoring the chat box while I go through this. So holler if you need something. Don't hesitate just to speak up. We have used this app for the past probably 3 counts now, because it's a lot easier to carry, especially in the cold, early in the morning in the dark, than a clipboard and a piece of paper and a pen. But also because it gives us real-time data, and we can see real-time the moment that a survey or an assessment has been completed. So once the registration is done, you hit the login. You're going to put in your email address that you used and your password, and hit login. And we're going to choose the count. We'll have a count key. I think that's what they call it, or a setup key each year for the different counts. And of course, each community who uses it has a different one. So we're going to choose our count. And it's COL 2022. I'm sorry, COL 22. Again, COL 22, not case sensitive. And then it will, you'll choose that count, and you'll let you know that you're counting for Muskogee Russell for 2022. Again, we're in a training mode or in a test mode right now. So Donald Duck, Mickey Mouse, and anybody else that you want to assess, please do so. We always encourage folks to use the app prior to the count, to get used to it, to play with it, to mess around with it. And that way you get more comfortable with it the more you use it. And because there are different surveys, there's the sheltered count, there's the unsheltered count, of course. And then there's what we call observation, and I'll talk about that in just a minute. So then we're going to get started. And it varies on your phone, and sometimes it varies between whether you've got an Android or an iPhone, or if you've used this before. It's going to ask you here or a little bit later in the process to allow your access or your GPS to be used while you're using this app. We always encourage everyone to do so, because we can get pinpoint accuracy as to where you were when you conducted that survey. And that's for a number of reasons. Number one, to see the geographical region. So if we're looking at a map of Columbus, and in a little bit I will show you what the command center looks like, we can see everywhere that we participated or did a count or did an assessment, whether it be a sheltered, unsheltered, or an observation. So we can look at, do we have 360-degree coverage of our geographical area? But also, if we're trying to locate someone a day or so after the count, people are creatures of habit, and we all have a tendency to go back to our favorite spots, no matter where they are, what they are. So the first place we would look would be according to the location of where the assessment was done. So that's one of the reasons too. And again, it's just a little bit more accurate than you trying to type it in. Again, we're in test mode, and this yellow screen or the yellow bar will be at the top of your screen on your phone. And I keep saying your phone. We started using individual phones during COVID, so that others wouldn't be touching your stuff and this and that and the other. And because it is a HIPAA compliant software that is web-based, and that once you hit submit survey, it's gone. And because once the volunteers come back, we uninstall the app from the phone, then there's no chance of sharing information anyway. Once you've submitted the surveys, they go to the cloud, and only are accessible through our command center. But it's just a more comfortable way for folks to do it, rather than fumbling around with someone else's device or whatever. But as I said, we can do unsheltered counts for those that are outside, Riverwalk, Bridge, those kinds of things. And we do our sheltered survey That's why our survey, our point in time count is broken up into 2 nights. And we'll go into the details, or 2 days, I should say. We'll go into the details of those days, but it's February 22nd and 23rd. The first day is the sheltered count, and the second day is our unsheltered count. And the one in the middle there with the red arrow pointing to it, that's the one that I talked about as an observation. The only time we use this is if someone says, nope, no, I'm not talking to you. We're doing an observation. Our gut says, yeah, he's probably staying there. Everything around looks like that person's probably living there, but they don't want to participate in the assessment. They don't want to do a survey. Sure, got it, but we're going to use an observation. For you guys who do outreach, it's an excellent tool to be able to keep track of who you saw and where, and that you went back. And if you're interested in talking more about that, let's talk at another time. But it's a really good tool to have. I know some of our city employees have used it during the year, not during point in time count time, but during the rest of the year to let us know where they saw people. So that's a really cool thing to have. But as I said, we'll be doing a sheltered count on the 22nd, which is a Tuesday night, and a unsheltered count on that Wednesday. We will be doing individuals or households. An individual obviously is one person. A household is whatever that person claims to be as far as a household. It could be me and Tiffany. It could be me and Bill. It could be me and my grandchild, or any combination thereof. We're not considering a household to have to be a legally binding agreement, such as a marriage or whatever. Although you would want to ensure that if an adult is there with a child, that they do have guardianship or legal custody of that child. But you won't do that as part of the count. I'm sorry, going off into my own other world. Your household, yeah, it's me and my 3 kids. Okay, we're gonna do a household interview. Oh, no, I'm here by myself. Okay, that's then we're gonna do an individual count. And then you know what? There is one thing I just realized. There is one. Oh no, there we go. Okay, cool. So as I said, we're going to have 2 days of counts: our sheltered count and our unsheltered count. The sheltered count, if you sign up to volunteer, or you know somebody who volunteers for the sheltered count, we're going to tell you what to select for project type, what to select for organization, and what to select for project. So while we're in training, you click on anything you want to. But if you're going to a shelter, we're going to tell you whether or not it's an emergency shelter or transitional shelter, because we do have some of those that we will be doing, and the organization name and the project type. And those are very specific. So you'll be assigned that. And before you leave, you'll have a slip of paper. Your team lead will also have that information as to what you'll select. But again, in training, select anything you want to. And all of it will drop down for you. There's nothing that you'll have to type in. If the location that you think you need to select is not on there, you need to get with your team lead. And we'll talk about that more as we go into as we get closer to the count. We'll put out some information and some handy dandy tips, and we'll talk about it again the night of and the morning of the count. But we'll select the project type, and then the organization and the specific project that we're at. And again, it may ask you here to allow for the location. So we're going to do that. The first question is always. So for instance, if you're at the Salvation Army Family Shelter, and you encountered this female, and you said, ma'am, are you, I'm here to do the count for those experiencing homelessness who are staying in the shelter tonight. And she said, yes, I'm staying in the shelter. I said, okay, are you by yourself? No, I'm here with my 3 kids. Then you would select of course, the household. You go through the project type. But then the next question, the actual first survey question is, have you already been interviewed today about the point in time count? If the answer is yes, it'll go away and say, thank you, no other action required, and then we'll hit submit. Of course, because we don't want to do the same people over and over again. If we are, excuse me, if the answer is no, then it will go through a series of 24 questions. And first name, last name, those kinds of things. We'll go into where are you sleeping, or where did you sleep, either were you sleeping tonight, or where did you sleep last night if you're doing it the morning after. And goes through age and all of the other general questions that we all do in our enrollments. How long you've been on the street? Do you have any medical conditions? Those kinds of things. Always remembering the client has the option to refuse, like, no, I ain't answering that. Okay, keep moving. And we go through and answer all the questions as best you can, based on what the client tells you, not based on what our observation is. If we are talking to the client, say, hey, listen, I'd like to collect any contact information, any other information you want me to share, you put it in notes. Also, if you observe something that makes you feel like a little special attention needs to be paid, you can also put those notes here and hit submit survey. Your survey will be submitted and you can't go back. Like I said, once it's submitted, it's gone. It's gone forever. That's again, probably as quickly as we did this is how will take us to is how quickly you can go through and get a survey done with a individual. A household takes probably about 3 minutes longer. So we do an average. We tell people average from 7 to 10 minutes per household. We'll send out these slides like we always do, but the waivers for confidentiality and release of information for pictures and those kinds of things. If you click on the little link here, it takes you to all those and you can sign those electronically, and then they'll automatically come to us and we'll have them. I'm going to stop sharing for just a minute and see if anybody's got any questions. Okay, I'm seeing here, what are the times for the point in time count? Okay, yes. Let me get back to you. All right. So the point in time count will be again Tuesday and Wednesday. Tuesday, February the 22nd is 5:30 p.m. to 8:30 p.m. Conversely, Wednesday, the 23rd of February, we start at 5:30 a.m. and we'll end up at 10:30 a.m. And there'll be teams in the sheltered count. We'll have teams of 3 to 4. The unsheltered count, which will be out again, Riverwalk, Bridges, and all of the other sundry places that folks have a tendency to have encampments or congregate. It will be a team of at least 3 with an escort from law enforcement. So most teams will have 4 participants and their law enforcement escort. So no worry about that. Each team will be led by a person who also has done at least 2 of the point in time counts. So they will have had the experience of doing it before, to make sure that all bases are covered. Any other questions before we get rolling along? We probably can get out of here in the next 10-15 minutes if we don't have a whole lot here, because we're wrapping up and ramping up for our semi-annual meeting. I know I was going to mention that in just a minute too, when we talk about what's coming up. So let me get back here. Also in the, I need to share my screen. My apologies. Uh-oh, it doesn't want to go there. There we go. All right. To volunteer, the link is there and it will be in the slideshow as well. So going on to a couple things, let's look at our referrals for January 2022. It looks like we had 143 referrals that went to programs across the continuum for the month of January. And then the breakdown is there. Tammy will be contacting each of your programs in the next week or so to ensure that you have received all of your referrals, that there's no complications, because we'll be rolling out a new streamlined referral service with ability for you guys to acknowledge it, send it back with the Appendix J and everything else pretty automatically in the next couple of weeks. So be looking out for that. It'll all be effective March the 1st, but we were rolling it out and trying it out a little bit early. Any questions about referrals or anything? I know that effective, I think last week, Safe House Ministries, listed here as Grace House, not quite sure why, has put their referrals or their acceptance of referrals on hold. Homeless Resource Network is taking limited referrals, as we all know, only for Hopwa. And so is there any other update that anyone has on referrals? I know we have several that have been out there and open for quite some time. Again, and Tammy will be sending out that list to everyone to address those. We're not actively participating with the client, or I should say, if the client is not actively participating with the agency in accessing housing, then perhaps we need to review whether that's an active referral at this time. Talking about getting tested and all those other things, we all know that information, and that we left it there again for this month because we're still we're still in a pandemic. Numbers are coming down, but we're still in a pandemic. Any agency updates? Nobody has said a word today. Somebody's got to say something.
I have an agency update.
Hey there, Virginia.
Hey, everybody. I just wanted to let everyone know that Kimberly Allen is no longer with the PATH program.
Okay.
And we're sad to lose her, but she is definitely going to do great in her new position. I don't think they're on the call today. I didn't see them.
I see Miss Allen right there.
I'm
you see
here.
it?
Thank you.
Okay.
I see it right there.
So y'all congratulate her. Sadina from Salvation Army stole her away. But anyway, I just want to let everybody know.
Okay, well, thank you for that, Virginia, and congratulations, Kim. And so tell us, Kim, if we're going to put you on the spot, what is your position over there at the Salvation Army? And how can we get in contact with you and all those other things?
As of right, well, thank you for the congratulations. As of right now, I'll be doing housing services, working with the ESG grant. As of right now, you can just call me at the Salvation Army number. I'm thinking it's 706-327-0275.
Hold on, Kim. I'm putting it in the chat box, so hold on.
Okay.
Hold on. Okay. Contact Kim Allen at 706.
Yes, 327. 0275. I hope that's the right number. Today is the first.
If not, we're going to call that person and say, Miss Kim said to call her here. Mm-hmm.
I haven't set up my email and things yet, so I'll send it to you to send to everybody. Okay. And we'll be working with taking referrals and stuff once they transition out of the hotel motel program with Salvation Army, and then I'll be transitioning them into permanent housing through the ESG grant.
Cool. All right, and I'll send you another update for your COC membership, so you can update that as well.
Thank you.
Mm-hmm. Anybody else have any? Virginia lost her sound, but anyone else have any pressing updates?
Hey, Pat, how's it going?
All right, how are you?
Doing great. So, as you know, sometimes our lives take us in circles, and I'll be leaving Department of Public Health here. My last day here is January the 15th.
No, January 15th is already
February the 15th. I wish it was January the 15th, actually. And I'll be transitioning to Department of Community Affairs. I will be doing the Georgia Rental Assistant Outreach Coordinator position for this area. And hopefully that will liven things up a little bit. So I look forward to helping everybody spend down this COVID money. So that's primarily what I'll be working on, is the COVID money to help with rental assistance and utilities. So making sure everybody's got access to that and handling any issues and difficulties. I have not had any training. I do not have my contact information yet. So I'm not sure exactly what all is going to entail. But I am ending my 5-year career here, but I'm still with the state, and I'm looking forward to stepping into this new position and coming back to housing. So, and I've always believed housing is the utmost of importance. And I, of course, I'm still very involved with the Narcan distribution and stuff, because that's kind of something I was doing anyways prior to this. And that relationship still remains intact, because Georgia Overdose Prevention is like, well, until you give us the okay, we're not transferring anything anywhere. So I'm still, of course, doing that for individuals who are at risk for overdose. We still want to make sure people have access to that. Also set up a whole access to Narcan through the health department. So anybody who is struggling with opioid use disorder and needing to get that life-saving medication, please make sure that you go down there to the health department and get it. So we have it in all this district. Now, other districts haven't done that, but that's kind of how I spent down my money. But wanting to make sure that that was available. So just letting y'all know, I'll be joining you on the regular.
Awesome. Well, that
my face.
In fact, Cheryl, there's a couple of things. Number one, we're going to sign you up in the next couple of months to present about the Georgia Rental Assistance Program. I know Mr. Louis is sitting at the edge of his chair right now. I saw him sit up when you said Georgia Rental Assistance. And Cheryl, just let me just give you a heads up. Although it's 3 letters, around here it's been a 4-letter word. Very, very frank, and I'm sure you already know that. But we'll need to have you do a presentation for us in a couple of months. It looks like Louis got some questions, but it's definitely most needed in this area. There's not a day that goes by that I don't get a call that from someone that was directed to call me from DCA that is not in this jurisdiction. I mean, it's usually north of Atlanta or the Albany area that they're calling from. And I'm not quite sure what the disconnect is. So Louis, you take it away, and guys, get ready for the conversation.
Cheryl, this is Louis. I'll limit myself, even though I'm extremely pleased. That's the best news I've heard lately. So that we'll have somebody that we can talk to, because in working with landlords, we're really in a mess right now with it. And Pat and I are working hard at it. And then we got a curveball thrown at us at the council meeting. I went down to support Pat in telling the city about the count. And then the city manager insulted somebody in front of me, and I had to get up and protect him after I got through, because we got an ordinance that then on the second reading, which was just this past week, the person sponsoring it decided to put it on hold for 60 days. So we've got a deal that affects landlords greatly, and it's a whole different area. But Cheryl, congratulations, because we need somebody that's got a heart at working for people to be helping landlords and tenants. I mean, we're all here trying to help tenants mainly, but you got to help the landlord to get everything going. And we're having trouble getting landlords to participate because they have so much trouble with the government everywhere they turn, whether it's the city, but mainly the rental program. And of course, I'm familiar with it. I've done them also for Alabama and Georgia. And it was hard to believe that a month ago, out of all that 550 something million, Georgia had put out less than 25% of it. So I'm hoping that when we do get to talk to you sometime before the end of February, to keep our blood from, running cold again, that we will at least have someone that will tell us the truth. Right now, we can't talk to anybody but artificial intelligence, and I don't do too well at that. So thank you very much for telling us that. I'm looking real forward to working with you.
Good. So, and I worked with Homeless Resource Network and housing prior to going to district clinical services and working with HIV as a case manager. You know, I have been involved in the housing, and even when I was doing case manager, I was still working with trying to get people, making sure they had housing, access to, you know, help with their rent and so forth. So, you know, it's just, I understand that a lot of times the politics of this COVID money can bring, it's like, oh, we've got this big solution and just dial this number, and there's no answer to the question. And you know, a lot of times I've heard people have requests for assistance out there, and they don't know, you know, it's kind of like food stamps, you know, they kind of they just disappeared. You know, we don't have DFACs anymore. They're somewhere. They're not in this building. Shh. You know, but they're, you know, it's hard to get an answer. It's not a day goes by that I don't enter the front door at 2100 Comer and somebody's at the desk just fussing about how I can't get access to services. And that's one thing too, you know, even though I'll be working out of my home, I'm hoping that I'll be able to also maybe, you know, I know COVID's made a mess of stuff, but hopefully I'll be able to also work out of, you know, my partner's offices too, being able to bring resources and bring more information. And of course I want to, you know, but my training starts on the 16th. I am determined to find out what's up with everything, because I've heard a lot about it, you know, because I'm just like, what is going on? Because I've heard, I see it. I've directed people. I'm like, well, go to the COVID, you know, DCA, you know, hotline and apply for some assistance, and then people don't ever get it. And that's an issue because, you know, we all depend on a house above our heads. So, and without that, we don't have anything, you know. So without housing, you don't have healthcare, you don't have access to, you know, how do you keep a job? How do you do anything without a home? So, and that's one thing, you know, I've always believed, you know, housing is healthcare. Housing is the health of our community. And if we're struggling with, you know, just putting, you know, the rent, you know, trying to pay the rent, then how do we feed our kids? And so much has gone on. But like I said, I've been working in this community, at-risk community. That's been my calling since I went back to college the last time. So, and I look forward to helping everybody out and figuring this out. So it is definitely an issue. So don't get mad at me, but I promise to bring y'all answers. Okay. And if I don't have the answer, I will be honest and say, I don't know, let me find out. So, because I believe in being honest and upfront. If I don't have an answer, I'm gonna find out. And trust me, nobody wants to deal with me if I don't have an answer.
Well, let me just close one thing in thought, is that in the situation of all the people I've dealt with since I've been on the board, there's no politics involved in this, because we're worried about homelessness and putting that person in a house. And I want to compliment all of y'all. Y'all are dedicated people. And I am so proud of what Columbus has done through all of y'all. And I hope that following all y'all's good example, that I'll be able to better serve, in which I've already learned an awful lot from each of you. And I just want to thank you, you know, for all the wonderful cooperation we get from one another.
Thank you, Mr. Louie. I think that I can't even share my screen right. That says a lot. But we're glad to have you as the landlord, who has been a huge missing part of what we do. And you have been instrumental in trying to bridge some of those gaps and those relationships. And Cheryl, you know, having been able to be able to give people answers, like, you know, is so important. And talking about landlords and rental assistance and those kinds of things, you know, like Cheryl says, housing is access to everything. And it's how people sustain and sustain their way of life, but also prosper, is to have good, adequate, safe, affordable housing. So on that vein, we're making safe, affordable housing at the heart of our semi-annual meeting next week, which is February the 10th at 2 p.m. And it's going to be a complete Zoom call. we're going to have the lead inspector from the Housing Authority of Columbus to join us to talk about what a HQS or Housing Quality Standard inspection is, so that we can educate landlords. The Housing Authority has done a wonderful job in redoing all of their landlord material for a complete packet of everything from beginning to end in the process. And we will have all of those and handing those out virtually, obviously, on next Thursday as well. So we've invited probably 45 different landlords, small individual landlords with 1 or 2 units, to major management companies to join us. And we hope that this is the beginning of the discussion, or the reinvigoration of the discussion, because very frankly, last year when Georgia Rental Assistance was rolled out, we had some really, really, really good conversations, and we were building some momentum. And when landlords were waiting 4.5 to 5 months to get a check, they stopped talking again. So we'll be doing that. Of course, point in time counts the 22nd, 23rd. Vote writers will be in our office for the ID clinic on February the 17th again, at 5 p.m. And then we'll meet together again here on March the 1st at 3 p.m. After the March 1st meeting, we will go back to the hybrid meetings of, in fact, we may do it with March 1st. We'll see how the numbers are looking. But we should be good to go back to March 1st to, if you want to come to our office and hang out, we'll do that. In fact, we might have some, some shamrock cookies or something, that be that close to St. Patrick's Day. Anybody else have any other updates, comments, or whatever? We've got some resources here about our point in time count. As many of you may know, the VI SPDAT, which we have all used for many years to prioritize clients on our lists, is going to be going away after June 30th of this year because the licenses have expired. And there were some issues as to whether it was a assessment tool that was totally unbiased. So we're participating with statewide housing needs assessment evaluation to see, what are some other ideas, what are some other products other folks are using. So there's going to be some discussions that are taking place. If you click the link that's going to be on the slideshow that we're going to send out to you, you'll be able to access all of those webinars. There's also all kinds of other discussions going on online. If you don't belong to the HUD Exchange, I would consider signing up for that, because those come out almost every other day about discussions about that. But prioritization is key to making sure we meet the needs of the most vulnerable, but also making sure that it's in a fair and equitable manner that those assessments are done. And I'm going to stop sharing here. Absolutely. Well, Kim, I can't send Sandina the link now because we're almost done. But for some reason I have to check what's going on, because I think it's going to her spams because she's on our invite. If you have not, guys, please put your name and organization in the chat box, because we do use that as verification of attendance. And just an FYI, if you are a program that gets ESG COC funding, participating in COC activities is part of your scoring process. So you always want to be able to make sure that you get credit for attending the meetings. Again, next week we have our semi-annual membership meeting. We'll go over, again, inspections. We will also talk about Lindsay Reese from Hope Harbor will talk about emergency transfer and the Violence Against Women Act. So we'll go over that. We'll also talk about equal access and our requirements to adhere to that, and the postings that all of us need to have in our office to make sure that we are in compliance with that. I'm going to give you guys about 90 more seconds. Any updates or anything else? Everybody recorded their attendance. Nothing going on. I do have an announcement. Many of you may notice that Nishada is not on the call today. Nishada's first day at community schools as the community school coordinator for Brewer Elementary was today. She hung up her Home for Good case management hat yesterday afternoon about 5:30 and became the coordinator at Brewer Elementary this morning. So we're very proud that she's still with the United Way organization, but she's moved into a different role that is more aligned with where she wants her long-term career goals. So any other questions? We got about 30 more seconds.
I had a question. So, does Home for Good still have housing case management?
Yep. Yep.
Okay. And just so I'm just clear too, how does that work? Is it only for your programs that you guys have them enrolled in? Or?
Yes, we can only case manage for the, as of today, we
Okay.
can only case manage those that are enrolled in our ESG CV program, right?
Oh, okay, just ESGCV. Okay.
Yeah, because that's the only housing program that we have. The others we're for instance, emergency housing voucher or moving to work. Those are just programs that are housing authority programs. All we do is we're the vetting agent to make sure that the client is in compliance going into the program.
Okay, and with the emergency housing program, I understand that it's a lighter version of the moving to work. So are they required to have case management, long-term case management as well?
No, ma'am. No, ma'am.
Okay,
That's the light part. Yes, ma'am.
gotcha. All right, well, that's all my questions.
Thank you. All right, guys, with nothing else, we're gonna go ahead and wrap this up. See everyone on Thursday at 2:00. Louis, if we can touch base in the next day or so, just to make sure that we've rattled the cage of enough landlords.
Okay, very
and
good.
got enough response. That would be
Thank
great.
you.
Thank you, guys. See you later. Congratulations, Kim and Cheryl. Virginia, I feel
Thank
your pain.
you.
I'm in the same boat. See ya. Bye.